Hi, good morning, Professor. Thank you so much for giving us the time. My name is Dr. Sushant Khurana and representing Pristyn Care today. How are you doing, sir?
I'm fine. Thank you, Dr. Sushant, for inviting me in this webinar. I'm really honored.
Brilliant, sir. Thank you so much. Just for our audience, I'll just give you a brief introduction of you before we get into the conversation. So today I have with me Professor Samnun Taha, who's a trained geriatric physician and has been trained in Bangladesh and in the UK. He has been working in Bangladesh as a consultant of geriatric medicine in different hospitals. And then from 2018 onwards, I think he established his first geriatric specialized hospital, a senior citizen hospital in Bangladesh as well. And he's also involved with the several non-profit NGO working outfits, especially working with the geriatric care. Thank you so much again, sir, for joining us today. In this series of webinars, what we want to do is just have a conversation with the esteemed professors like you and understand how you have seen the healthcare change over the years and how you have seen healthcare grow over the years and what do you think are the future trends. So I'll probably start with my first question. If you'll be kind enough to describe your journey as a physician to us, how you got into medicine and what you learned over the years and practice over the years.
Oh, well, medicine has been a family trade for me. I mean, my grandfather's father, all were doctors. So I followed the path. It was an easy choice for me. And passed long ago, actually. Finished my intern in 91 and then started my journey as a doctor. That was long time back. Becoming a consultant itself takes a lot of, it's a journey on itself. You work as a intern, then house officer, then senior house officer, registrar, and on the way you pass those difficult exams and a lot of other things, and then a post has to be available to become a consultant or a junior consultant. And I had to cross all those paths. Those were difficult times. And I did some of my junior years I spent in Bangladesh, and some of them were in NHS UK. But once I finished my general medicine degree in UK, which is MRCP, you know about it. Then my family was here. I decided that it's time to come back home. And I joined a big Red Cross hospital over in Dhaka as a registered, then became junior consultant. And, becoming a consultant is every doctor's dream.
True, sir.
Because not everybody can become a consultant. So I was thrilled, actually, when I became, I got that appointment that you will be a consultant and this unit will be under you. The units are sometimes named under a consultant, and it's a great honor, but it's a great responsibility as well. Because, when you are a junior officer, you are actually dealing with human life, and that's a big responsibility, isn't it? And sometimes one has to take crucial decisions, can be life and death decisions. And sometimes people do expire, and under your watch. Then every time, people sometimes think that doctors are non-emotional beings, but each and every death under your watch is really affects the doctor.
It affects you
Very
personally.
well.
I remember that.
Yeah, exactly. I mean, sometimes when you are younger, it affects you much more.
True,
I
sir.
remember the year I became a consultant, there was a dengue epidemic in Bangladesh. And I was working as a consultant in two hospitals then. It was horrible because in 2001, dengue was, nobody knew dengue before in our country. And it spread like fire. And so many patients came and we were all perplexed. Initially, we had this discussion, what is this? I mean, what's happening? And it was really bad. Most of the patients came with dengue hemorrhagic fever.
Yes.
I mean, that's a very serious conditions. And at that point of time, there weren't many ICUs in the country. And you know that in dengue hemorrhagic fever, you need to treat patient in ICUs. Only the two hospital I was working in, one of the hospital had an ICU. So that was a relief. And you know, and it was there for the consecutive 2 years. So my first 2 years of consultant life was really difficult. Couldn't sleep properly for 6 months after I became a consultant. But that's the life of a doctor.
So in fact, on that note, I'll probably just ask the second part of it. So now that you've seen the, let's say, the initial years, and obviously then you grow into that role and you are obviously a lot more settled in that role. Uh, how do you manage the personal and the professional life? How do you balance those? Like, but that's always a question for a young physician like me. How do you balance that personal and professional life?
Very difficult. It can be very challenging actually, uh, because if there is a serious patient under you, you can't really leave the patient, especially you know, if you're a medicine consultant, or for me it became more challenging, um, because I get geriatric cases, elderly cases,
Yes, sir.
with 5, 6 complications at the same time, and all. I mean, it can be really stressful, and sometimes things are so complicated that you know, the junior doctors get perplexed. So I have to be there sometimes. Um, uh, like this time in COVID situation. Um, a lot of elderly patients were admitted under me. And I had to run from the ward to the ICU, to and fro. And in a intense situation like this, you really don't think about family.
True, sir.
But very important. Um, uh, well, we doctors definitely seek a life of going back home in the evening, like any other person working in other professions, having the evening tea with our family, and have dinner, and you know, see your children grow in front of you. Yeah. But sometimes these simple things becomes really difficult,
Sure, sir.
because you know, because of the responsibility, because of the nature of the job itself, it's really difficult.
Absolutely, and I think I've also seen that journey while I was practicing, and that's one fine line that you always try to tread, how to maintain that balance. Sir, when we talk about the overall healthcare, let's say especially in the subcontinent, it has really evolved in the last 10, 15 years. What are your views on that in terms of how the healthcare industry overall has evolved in terms of betterment for the patients, in terms of the facilities that are now available for the patients, sometimes in cases of surgical outcomes as well, and healthcare outcomes for geriatric population as well. How would you define that journey in the last 10, 15 years?
Well, a lot of things have changed. When I became a consultant, I remember we used to get a lot of patients with stomach perforations, because of ulcer.
Yes.
But you can never find a stomach perforation nowadays because omeprazole is there.
Absolutely.
So
The drugs are such.
a lot of new drugs is coming. There wasn't much of a imaging. Even ultrasound wasn't always available.
Yes.
Later on, CT, MRI, X-ray, etc. So from when after working several years in as a junior doctor, I went to UK. I came across all those wonderful gadgets. But then again, in NHS, they have this policy of restricting
Yes.
a lot of imaging tests, expensive tests. They have a certain policy to cut down on the cost. And medical audits, where we had to face medical audits all the time
True, sir.
in UK. Though this medical audit is a wonderful thing, which hasn't become it's not there in everywhere in Bangladesh or India, the strict medical audit that is being followed in Western countries. But I think this is one thing that we lack and we really need to introduce. And in terms, if I say that what has changed, a lot has changed. We doctors have become empowered with a lot of new gadgets, medical gadgets, which are available all over Bangladesh, all over India, all over the subcontinent. Machine-wise, probably instrument-wise, we are at par with a lot of Western countries. But the thing is, there is also the healthcare has become expensive as well.
Yes.
One of the reason is a lot of new drugs has come in. Drug price has to be. I mean, newer drugs are more expensive, and now that since these techniques are easily available, so doctors tend to do them a lot. And so for the patients, it has become really expensive. And in Bangladesh, I can tell you, we don't have a health insurance system in place, universal health insurance system. It's all out-of-pocket expenses.
Out-of-pocket expenses.
So for a person with not very economically capable, the healthcare can become a real burden. But saying that, our longevity has increased a lot.
Absolutely, sir.
In Bangladesh, it is almost 73 years. 50 years back, it was 41 or so. One of the reasons is these newer drugs, newer gadgets, better medicine, also better service delivery, much better service delivery than before. And things like ICU backing and all those things. So previously, as far as patient is concerned, the practicing medicine has become a bit easier than before, because if a person really gets the condition deteriorates, then you can always back up to a ICU, and try to save the patients. Dialysis is there. Dialysis is available. Previously, it was not. Think about 20-25 years back. Cardiac patients couldn't get a angioplasty or by CABG. All those things weren't simply available. But now it has become so much common a thing that it feels like I would say that in many if we compare Western let's say NHS, the facilities of NHS with the facilities of healthcare in the big metros of subcontinent.
Yes.
Except for the financial part, I would say from service delivery point of view, it's almost
We might
at
actually be
par.
better. We might actually be better, sir. The kind of waits that we had in NHS, the
We might be
timelines that
actually better because yeah, there's no waiting time here.
absolutely.
I mean, in NHS, you have to wait so many months for even a small operation, but here you don't need to.
Absolutely. But I think, like
So
you said,
that way
affordability is a challenge.
we are much better than before. Then
Absolutely. But like you said, I think affordability is a challenge and those facilities are not available to everyone. Having said that, I also completely align with the thought that the diagnostic chain has, I think, improved much faster than the treatment change. And also, when you say some of the challenges that, let's say, the Western world has are very different from ours. Let's say we still fight at a level of primary healthcare where they're practically focusing a lot more on tertiary healthcare. And I think that's one of the changes that will happen over the period of years. Uh, and in accordance to that only, sir, we also have seen a lot of technical or health tech enablements coming here in India, at least. How do you think the healthcare industry in Bangladesh has been adopting to the technology, and what do you see the future of technology in, let's say, practicing healthcare and practicing safe medicine?
technology is progressing. The major advantage is, any new drug that's coming into Western market, we can get it within a very short time over here. Any new instruments that is introduced in Western world comes to us very soon. But technologically, I'm sure this big role, telemedicine. It has been very popular during the COVID times.
COVID.
But but in my experience, people prefer more. At least first visit, they prefer to see the doctors face to face. And we are doing follow-ups through our mobile phones a lot of times. So this is something that has changed. The home care concept has come in.
Yes.
And a lot of tests can be done at home. That is convenient for the patients. So in near future, probably AI, artificial intelligence, is going to come in the picture as well. That will assist the doctors in diagnosing better. You see, there are always difficult cases, 5-10% cases where doctors really face difficulty in diagnosis what's the problem. So in those cases, I'm sure that AI-based gadgets will play a significant role. And apart from that, new diagnostic tests are coming in. So those are going to help us a lot. In another sense, our average longevity is going to grow in the subcontinent a lot. And we used to think that previously that these elderly populations, they only live in the West.
Yes.
But it's becoming a Eastern problem now as well. I don't call it a problem. The Eastern phenomena now, because it is said that by 2050, 70% of the elderly will be living in subcontinent, China, Korea, this part of the world. So things needs to be evolved because healthcare has to become more human. Healthcare has to be integrated with social care. We doctors have to come down from our high pedestal
Yes.
and learn to work with other professionals in healthcare. Geriatric care is a team effort. So I see the future medicine to be rather a team-based approach.
Absolutely.
Doctors, nutritionists, uh, physiotherapists, and a lot of other healthcare workers working together, rather than the way we practice medicine one-to-one. I mean
Absolutely.
that is going to change a lot.
Absolutely, sir. I think, like you very rightly said, I think it has to be a lot more collaborative between the functions rather than just one specialist looking at it. So you touched a very interesting point, and I know that geriatrics is very close to your heart as well. Can you kind of shed some light on, let's say, specific requirements for these geriatric population when we talk about their surgical needs or their medical needs? And let's say you spoke about insurance covers some part of our population, but not all. But are there any specific insurance covers or plans or products that are applicable to the geriatric populations? What have you seen in your practice? So specifically according to their medical needs, and then probably the second part is insurance, if that covers the geriatric population.
Geriatric, as I said, that the approach is a bit different from the general medicine practice. It's a team effort because they have multiple problems. Also, you cannot solve all the problems with only medicine because as a matter of fact, pain is the number one problem in an elderly.
Yes.
So treating pain with only medicine is not a proper way to handle it. You need to take a physiotherapist's help, and sometimes now interventional pain therapy has come in the picture.
Absolutely, sir.
And those are wonderful gadgets. Nutrition is a big issue in an elderly population. A lot of them I see a lot of patients with protein energy malnutrition, because even from affluent families, because simply they don't want to eat. That's the problem.
Yes.
And they need special feeding or a special food composition. And along with these, there has to be modifications in their toilets, in their bedrooms. One fine night or day,
They'll have a
they are
fall
going
and
to
everything goes
fall
down.
down and break their leg. So preventive parts needs to be taken into consideration as well. And apart from that, one very important disease is growing in the elderly, which is dementia.
Dementia. True, sir.
Dementia, in Bangladesh, there was a recent survey where it is shown that the dementia patient is about 1.1 million in
Wow.
Bangladesh. And I read in one of the article that India, it's about 11 million.
Easily, I'm sure, sir, it
So
would be
it's a lot of,
and that's what I read.
and dementia treatment, it's a very difficult approach. I mean, you need a lot of social support. So medicine is, this geriatric medicine is not only medical support, social supports come into it as well. And you have to mix it together and balance it. And also, the stress is on the family caregivers, because family members are the first person who has to take care of the patients. So family caregivers needs to be trained. And also, then if they fail, then other caregivers has to come into the picture. So it's when we are planning a treatment for a geriatric patient, you are not only treating their disease, you are planning their whole life, or probably their life for next 10, 20 years. Geriatric physician's role is monitored the whole thing. It's a different approach from what we are doing right now.
So what
Very,
about the
very
insurance?
interesting.
Would you have some words for the insurance if they want to cover these geriatric populations, or they start covering these geriatric populations?
Should, because obviously, since they have got multiple comorbidities, definitely the treatment is much more expensive, and the issue here is covering only geriatric population. If there is an insurance scheme, it will become very expensive. The best approach is universal coverage, because universal coverage gives coverage to everybody, but not all persons, younger persons don't get sick.
Yes.
So if we target, but in Japan, they have two types of insurance. One is universal insurance, and insurance are separate for elderly care. So from the day a person joins in their job in Japan, he starts planning for his old age. This approach we have to bring in our countries as well. That one day you are going to become old, because people you may have a very long life, which is a good news, but it can be a bad news if you don't plan from it from younger age.
True,
So
sir.
that is
I
very
think
important.
it has to be a cultural and a behavioral change that starting from a very, very young age. On that
Yeah.
note, sir, I'll probably just ask the last thing. If there is any advice that you would like to give to young doctors who are, let's say, getting into medicine in Bangladesh, or in the subcontinent, or people who are starting their journey as junior consultants or senior residents or registrars, what is the advice that you would want to give to young surgeons and physicians, sir?
Well, it's a tough life, but if someone enjoys it, it's a wonderful life. Serving people, I mean, you may not get thanks always, but one or two cases that you really try, and you make a person better, and you see the smile in their face, or in their relatives' face, it really brightens your life. So, but if anybody is into medicine for earning money, I mean, it's not always that easy. It's very difficult, really,
It's a long journey. It's a long
because
journey before you actually reach
it's a long
somewhere.
journey, and it's becoming more competitive day by day. So, uh, uh, for money, if somebody thinks that I'll become a doctor and become rich and have a very comfortable life, probably they should seek some other way. But if somebody wants to serve his fellow people, and as well as have a more or less comfortable life, I believe that it's a wonderful life to live.
Absolutely, sir. Absolutely. And like you said, I think the expression that you see on the family's face and the patient's face when they recover, I think they are priceless. And that's what we get into medicine for. And I think that has been one of the most fulfilling things. On that note, Professor Taha, thank you so much for spending time with us. Really pleasure speaking with you, sir.
Thank you, Dr. Sushant. Thanks a lot.
Thank you, sir.